Jane Low, and I'm at the Resort World Sentosa here in Singapore a day just after the Health-ISAC APAC Summit 2023. And with me, I'm very pleased and very privileged to have Errol Weiss, who is the Chief Security Officer of Health-ISAC, all the way from United States of America to Singapore. So thank you so much, Errol, for your time today.
Hi, Jane. It's really great to see you in person.
Yeah, I know, right? It has been, I think, almost 3 years since we last talked, of course, at the height of the COVID pandemic, and it was over the phone. So it's great to see you face to face and get the latest since in the last 3 years, right, since our chat. But before we do that, if we could just very quickly get an introduction from you about yourself, about Health-ISAC, and of course also about the summits here, which I believe is the first one in Asia Pacific.
That's right. Yeah, we've been planning this for 3 years, but due to COVID, we've been delayed. But we're really thrilled to be here this week. Finally,
I know, right? Yeah,
we had a great conference. So, yeah, it's great to be here with you. So again, I'm Errol Weiss. I'm the Chief Security Officer at Health-ISAC. I've been in this role for 4 years now. Prior to that, I was in the banking and finance sector for about 13 years. I worked at places like Citibank and Bank of America. When I was at Citibank, I helped create the Cyber Intelligence Center that provided threat intelligence globally for thousands of internal employees there at Citibank.
Cool. Okay.
So I've been in the threat intelligence business for a bit. I was a big contributor and participant with the Financial Services ISAC, so I know what it's like to be on the member side as well. And when I got to this role at Health-ISAC, I helped create many of the functions and services that we deliver today for our members.
Right, and the first thing that I want to ask, of course, is about your recent release, right, about the cyber threat landscape in the health sector.
Right.
So I think you pointed out like the top 5 threats are ransomware, phishing, and I believe social engineering was also one of the top 5. Can you tell us a bit about how different these threats are in the health sector compared to other sectors?
Yeah, I think the big issue for us in the health sector is that there's just the level of investment in cybersecurity is still catching up, and that therefore it makes for a lot of vulnerable targets in the health sector, which I think is one of the reasons why malware and ransomware is so successful in attacking and obtaining victims in the health sector. And then, of course, these organizations are not well protected. They might not have backups. They might not have operational backups as well. And again, they make for good targets because they're caught in a situation where they have some very tough choices to make, and sometimes the only choice they can make is to pay the ransom in order to get access back to their systems so they can continue to provide life-saving services.
One question I think a lot of our audience will have is, when we hear about cyber threats and attacks in the health sector, we think of WannaCry, right?
Right.
Which hit, of course, the United Kingdom's hospitals. I think was quite a big impact.
Right.
So that was back in 2016,
16, 17.
Right.
Yep.
Yeah. So can you tell us a bit about how, those kind of ransomware attacks or breaches has evolved, right, over the last, I would say about the last 5-6 years now in the health sector?
Yeah, I think when I do these threat briefs, the news is never good, right? And it seems like it gets worse every year, and it does.
It does. Oh wow. Okay.
And I think that the cyber criminals continue to evolve, and they are very sophisticated, very determined to monetize whatever operation they have running. And so, ransomware itself is an attack type that has certainly evolved over the last probably, I'd say, 10 years at this point. But now we're hearing about double extortion cases, right, and now triple extortion as well, right? So the ransomware case is, I come in, I encrypt all your files, and you can't operate, so you have to pay me. The double extortion is, I encrypt your files, I steal all the information as well, so if you don't pay me, you don't have access to your systems, and now I will release your files publicly as well. Mm-hmm. The triple extortion now is, I do the encryption, I steal your files, threat to release them, and then the third part of that is, now I will DDoS you as well, so the distributed denial of service. So I'll just take your websites down until you pay.
Until you pay.
Yeah.
So I don't know whether it's the information that you can share, but when it comes to ransomware, or rather ransom demands, are the amounts that, higher in the health sector? Because I guess we are thinking that the attackers realize that it is a life and death situation.
Right,
so
right.
there's a opportunity for them to demand higher amounts. Is that what you're seeing?
Yeah, and we're certainly seeing. I mean, the numbers are incredible, right? In the millions of dollars US at this point. Even in healthcare.
Right, yeah.
It's
and
a
of
lot.
course, there's also like a ransom as a service groups as well. So the evolution is becoming more and more sort of specialized, isn't it?
Right, and I think it's a trend that has continued again for 15 plus years at this point, where the threat actors have really always been specialized. You have people that are good at developing the malware, another set that's good at delivering the malware, another set that's good at figuring out who they have access to now, another set that figures, okay, how do we monetize the access that we have, and so on. And so that each of these groups in the cyber criminal chain, they work very closely with each other, but they provide all these specialized services. And to your point earlier about ransomware as a service, yeah, you've got threat actor groups now that are creating the ransomware as a service. They license it out to people who are willing to pay for it, and they provide support, video support,
right?
Customer service support for the people that need help setting up these extortion attempts. I mean, it's just amazing.
It's all very professional, isn't it? They
Yes.
even have their own, I read somewhere that they have their own HR department as well to recruit insiders potentially.
Yeah, right. I wouldn't doubt it. Yeah.
Right. Okay. So we just talk about ransomware, and it's a financial motivation. But of course, I guess we also hear or see some cases of other kind of motivations as well when it comes to COVID vaccine research, data breaches, and intel theft. Right, there's corporate espionage, or maybe potentially sort of nation-state actors involved as well, isn't it?
Yeah, I think all of those are certainly fair game, and certainly things that we've seen. And from the nation-state standpoint, I think the COVID situation was a really good example to see what happened when you've got nations who need to protect their populations because we have a new virus and no vaccine at the time. And so people are going to do what they need to do in order to protect the population. So if that involves stealing intellectual property to help develop a vaccine, they're going to do it. And I think we as human beings can understand and maybe empathize why people might do something like that. In that situation. But then unfortunately, right, this level of espionage really is just business as usual. So, okay, the vaccine's done. Now what else can I steal now to monetize or put my country or my company in a better situation than it was yesterday? So I can save on research and development by stealing it instead.
Right. And when it comes to Health-ISAC, which stands for, you got to remind me what it stands for.
Yeah, it's the worst acronym ever, I say. It's a Health Information Sharing and Analysis Center.
Right. Earlier, you pointed out how on the threat actor side, they share a lot of information, they work together. And of course, on the cyber defender side, one aspect of ISAC is really to get people to work together and share information and threat intelligence, right?
Yeah, it absolutely is. And you bring up such a great dichotomy here, right? The criminals are very good at sharing, and I just wish that the good guys here were as good. We do have, it was interesting, again, I've been in this role for 4 years coming from finance sector, and it was interesting to see sort of the differences in information sharing in healthcare versus finance. A lot of people will hear that the finance sector does a great job of information sharing. The Financial Services ISAC was the first one that was created in 1999, and they were off to a great start. But I will tell you that even in healthcare, I think we've got more energy, more interest in the information sharing aspects of it. People are genuinely interested in trying to help each other out, and I just think that level of energy and interest is just so much better than what I experienced in the finance sector.
So when it comes to Health-ISAC and the history of the organization, right? And now you are holding your first summit here in Asia Pacific. Can you tell us a bit about your membership and also your partnerships with other organizations, right, in North America and of course also around the world and now in Asia Pac?
Right.
And given the digitalization that we have seen over the last 3 years, especially during the COVID times. So when it comes to health, it's no longer just the corporate network side, but it's also, well, that is also increasingly vulnerable, but it's also all the IoT aspect as well.
Right.
So can you tell us a bit about, the kind of members
Sure.
that you're looking to, to
Okay.
join your organization? And
Yeah, so we've got right now about almost 800 institutional member organizations that belong to Health-ISAC, and that we don't sponsor individual members like you or I cannot join as an individual person. It's the organization that joins, and then any number of people within that organization can participate in Health-ISAC. So we have 800 institutional members. That translates to about 9,000 people behind the scenes that we're communicating with on a daily basis. Mm-hmm. Probably about 80% of those organizations are headquartered in the United States, but we have some very large multinational organizations, pharmaceutical companies, medical device manufacturers that have people all over the world. And so we literally have people in 100 plus countries that are participating in Health-ISAC today.
Okay.
So, and again, then locally in Asia-Pac, we've got about 5% of the members that are headquartered here, and it's one of the reasons why we were so excited about finally hosting the summit here. Is we want to do more in the Asia-Pacific region. We want to do more here. We want to get more members participating locally as well, and we're trying to ensure people understand what the value of Health-ISAC is all about. To further expand on the question. About 45% of our members are in the health provider space, so the hospitals, for example, and then about 15% in medical device manufacturing, pharmaceutical, insurance payment providers, insurance payers, I mean, and then academia. Then health IT services.
Oh, right, okay.
So like even electronic healthcare record software manufacturers belong as well.
Quite a big scope.
Yeah, it is. And interestingly, I would say like the summits that I've participated in Europe and then here in Asia-Pac, most of the participants really fell into the medical device manufacturing and pharmaceutical subsectors.
Right, and for potential new members who want to join Health-ISAC, what are some of the sort of tips that they can receive, right, from your latest publication of the Cyber Threat Intelligence Report that is perhaps more tailored towards the Asia-Pacific region?
Yeah, so the threat report that I shared with you, and we can certainly share with the listeners here, it talks about lots of different threats, and I think the interesting thing is on the emerging threat landscape, what's coming next, and we talk a bit about therein as well. But one of the things I want to mention here is and it was one of the conversations that we had at the summit that I wanted to share with you as well, is about really the interest in amongst security professionals about what's happening in artificial intelligence, and we use like ChatGPT, for example, and now we just learned within the past 2 days that Google is now launching their version of this called Bard, B-A-R-D, and from the security professional standpoint, there's a lot of concern amongst the security professionals because of the level of access now that cyber criminals or other adversaries have to technology like this, to use that to develop scam campaigns, phishing campaigns that they can use to target individuals. And so with the use of that artificial intelligence, they can really craft very believable, convincing, well-written in the native language, right? Pick any language and they can write it very convincingly in that language to target that specific individual. So, there's a lot of concern about that technology now. So we'll keep an eye on it.
So when it comes to Asia Pacific, so for our audience here, when they hear about ChatGPT and what are the potential sort of impacts it can have on social engineering, right? What would your recommendation be for them? Because I think phishing has been going on for so long, and the awareness, I think, how would you say the awareness is like in Asia Pacific compared to, say, North America?
No, I think the awareness is very good. We had some terrific conversations this week. I love the sharing that was happening that I saw here. That was all great. I think I would just probably pass along sort of the recent usual advice, which has to do with the use of multi-factor authentication, right? And being weary of some of the attacks that, back to social engineering, that people have been using to defeat some of the multi-factor benefits. But the use of multi-factor, regular backups of the data and operational systems, for example. And then the other thing that I would say is practice, practice, practice. So I do this with my team internally at Health-ISAC, for example. We have an internal incident response plan. We fortunately don't have a lot of incidents to deal with internally. So we practice, and we'll do no-notice drills, or we'll do a scheduled exercise, and we will talk about a scenario, and we will talk through what everybody has to do in order to respond to that. So a lot of practice. So when the incident does happen, we know what to do about it. And this is, again, just something I would encourage the organizations to do as well. And in addition to the multi-factor, patching, and then the backups that I mentioned before, now practice.
And that is one question I actually have when I was thinking about the health sector, because many services are expected to be on 24/7, right?
Right.
So when it comes to sort of cyber defenses, would you say there's a lot of focus more on the response and recovery side for the cyber defenders?
Yeah, and I think that's been a mindset that's been in place for at least the 10 years, that realizing that, hey, we can't 100% protect these environments anymore. It used to be that we had a firewall protecting everything was behind the firewall. It doesn't work like that anymore, right? Especially with, we love to use the example of what happened during COVID, and now we have everybody working remotely from home, and now it's even worse, right? So we realize we can't protect. The resilience mindset really comes into play, right? So it is respond and recover. So how quickly can I detect that there's been a problem, respond and recover to that? That is now where we're seeing the more mature organizations heading toward.
So you were saying, Errol, earlier that you have been with Health-ISAC for about 4 years now, right?
Yeah.
So what would you say in the last 4 years has been the greatest sort of developments in terms of the cyber defense side? Are we getting better at what we are doing?
Yeah, I think unfortunately the bad guys are our marketing engine, right? Because of the number of attacks, successful ransomware events that have happened. There is a lot of awareness. There's much more awareness now in the healthcare sector than when I got here 4 years ago about the level of the sophistication of the threat actors and the level of incidents that are happening in healthcare, unfortunately. And I think that that awareness is translating to all levels inside the organization. So the boardroom is seeing this. They don't want to become a victim. I'm looking at legislation that's happening in the U.S. now as well in terms of mandatory reporting requirements for incidents. Nobody wants to be dealing with this, right? They don't want to have to disclose these things publicly, but they're going to have to. So it makes for some very uncomfortable conversations. And I think, again, based on the information sharing that was happening here this week at the summit that we had, same level of consciousness, same issues that we're having. Much more difficult to coordinate globally, I think, because of everyone has sort of a nationalistic approach to this, and I completely understand where they're coming from.
There's a culture and language barrier as well, isn't it?
Yeah, absolutely. And so we need to try to figure out what kind of global standards maybe we can come up with, and more harmonization amongst the regulators so that we can deal with sort of one set of rules consistently. But it's going to take some work, and fortunately, I have seen from the players on the public sector side here in Singapore, even with the Ministry of Health, for example, they want to partner with the private sector to try to work this out.
Okay.
And they're reaching, across internationally as well to try to figure out what is the best approach. So I'm hopeful.
Right. Okay. So what is the last question.
Okay.
So what is the number one challenge then for people to work together to share information as well as the threat actors are doing on their side?
I think really the biggest barrier, let's say there's two, right? The organizational barrier, and then I'll say the human barrier. The organizational one is where companies don't feel comfortable putting that kind of information out there because they just don't trust the network, let's say. and we have ways to make that happen. Again, information sharing has been happening for 20 plus years
That's
at this
right.
point. And when I give talks about how to do it successfully, there is relatively little downside here in the information sharing that's happening, and very little risk to organizations, in my opinion. The second thing is on the personal side. It's just putting yourself in an uncomfortable situation potentially, and putting yourself out there. So, some of these information sharing forums, they can be very technical sometimes. People are a little unsure of themselves and they don't feel comfortable putting themselves out there in a very technical environment. I just try to keep pushing people from behind a little bit, try to say, hey, get out there. It's how we stretch and how we learn, how we grow. And I think that, myself personally, just having worked with FS-ISAC for all of those years and learning from all of my peers, not only on the technical side and growing that way, but also even from a management and a leadership standpoint, I saw some incredible leadership capability happening during incident times when things were really bad. And I looked at someone, saw how they behaved and how they operated, and I was like, wow, I want to be like that one day, and I hope I can be. And so I was able to learn from that.
Right, and you mentioned earlier how information sharing is actually very, very safe. And I'd love to get your take on how, as a chief security officer, how you secure all the information that has been shared. But I don't think that we have the time.
I was going to say we have to do another podcast.
Yeah, that's
then.
right. Exactly.
That's a deal.
Right. Yeah,
okay.
that's right. That's the deal. So,
okay.
But for today, thank you so much, Errol, for your time today to share with us some key takeaways from the summit, and also to give a brief introduction to our audience about Health-ISAC. So thank you very much, Errol.
And Jane, it's great to be here in person. And we have to show everybody that we're really here together, right?
Yes, that's right.
Yeah.